No matter the size or specialty of a healthcare facility, they all have one thing in common: their need for talented EMT workers. The team at Anderson County Hospital in Garnett shows us how EMTs and paramedics are integral to the daily operations of healthcare facilities.
Welcome to St. Luke's, a health system with multiple hospitals and campuses and hundreds of specialties and primary care practices. With thousands of employees, St. Luke's is excited to welcome more kind, motivated, and skilled people just like you. It's not all doctors and nurses. From the cafeteria staff to surgical support, housekeeping to security and lab technicians, there are rewarding opportunities for everyone. We're at Anderson County Hospital, one of St. Luke's critical access hospitals in Garnett, Kansas. This place is unique. While many EMS services are provided by a city or a private company, these first responders work directly for the hospital. Good morning, Troy.
Hey Dan, how are you?
I'm doing great. I want to hear about your career. What's it like being a St. Luke's paramedic every day?
It's exciting, wonderful, and every day's different. I can't wait to tell you a little more about it.
And I want to know about the trust you have in your teammates. You know, why did you choose this career and how do you build that trust with your teammates every day?
I started in EMS at the age of 14, got my EMT certification when I was 17, and I've built a trust with the people that I work with on a regular basis, and then we do that so we can provide the best patient care possible.
What has surprised you about being a paramedic? Anything that stands out?
The technological advances. You'll see some of the equipment when we look at the ambulances. It has really came a long way in the 20 years that I've been involved in EMS, for sure.
Being a paramedic is very stressful. How do you stay calm in those stressful situations?
Just goes back to our training and our experiences. You know, we train hard, we learn from the experiences that we've gone through, and we work together as a team. We have a true hazard going on. We'll need to get her out as quickly as we can. So our main concern is getting a patient like this to a trauma center, such as St. Luke's Plaza in the city, just so they can get further assessment and do any interventions that they need to do.
Well, that was some exciting training, Troy. I know that our audience is potentially thinking about a career in EMS. What advice would you give to someone who wants to pursue this full-time?
I think starting early on at a young age is really important. A lot of communities have an Explorer program. Youth age 14 to 18 can get involved with their local EMS, fire, or law enforcement. Once you do that, you can move on your certification to advanced EMT or paramedic. And there are so many different ways of getting tuition assistance with that. The Kansas Board of EMS has an education grant, and here at St. Luke's we have an education grant as well that can assist with that certification.
What makes being a paramedic at St. Luke's unique?
Yeah, we are one of the only hospital-based ambulances in the state of Kansas. There are a few, but not very many. It really makes it unique that we are able to work not only pre-hospital, but also in the ER setting or into the OR setting to maintain some of those competencies.
Troy, this has been a great front row seat to the work that you do every day. Thank you for what you do and keep up the great work here at St. Luke's.
Thank you so much for joining us today.
Thank you for taking the time to watch this behind the scenes look at St. Luke's. The Midwest is a great place to live and work, and we take care of a fantastic community. The next time you think about a career change, be sure to consider St. Luke's. There's no better place to give care and get care than here.
I want to welcome our panel of EMT paramedic experts to answer your questions about the career opportunities working as an EMT paramedic. Joining us this morning live from Anderson County Hospital are EMS Director Troy Armstrong and Advanced EMT Alex Dennison. Good morning.
Good morning, Cindy. Thanks for having us on this morning.
Yes, and they're joining us from the back of an ambulance, which I love seeing. This is great. Well, Troy, in the video you mentioned you were started working with EMS when you were 14 years old. What does that look like, and how might students watching today follow in those footsteps if they're interested?
That's a great opportunity for youth to get involved in an early age is the Explorer program that several different areas have, and it's through the Boy Scouts of America. Career Exploring is a hands-on program open to young men and women aged 14 to 20 years old with an interest in learning more about EMS, and they can also explore other career fields. Our local Explorer program is fire, EMS, and law enforcement. So we just want to give a huge shout out to several of our explorers that are online watching from different schools throughout the state. So kudos to them for all joining in and being part of that at an early age as well.
Thank you, Troy. And Alex, I was wondering, can you share a particularly rewarding experience that you have had as an EMT paramedic?
Yes. So recently, actually, Troy and I were both a part of the team. We responded to a cardiac arrest that the wife called 911. The husband went down, and she did CPR for about 15 minutes until we were able to get there. Um, and we got a pulse back, so we were able to take him to the hospital, to Anderson County Hospital, and then fly him out. And then he was back with his kids and his wife within a couple of days. So that was really awesome. Then we got to go talk to him and everything, and just talk a little bit more. So that was really special to be a part of. So
That is an interesting and very inspiring story. And probably working in a small town, you have more of those experiences, I would imagine, since you know a lot of the people around you.
yeah, that's definitely one of the harder things, but it's nice to be there when you do know somebody, for the family to be a part of it. They know. I mean, a couple times, the family's outright said it's nice that you knew somebody when they walked in the door, because it's usually possibly their worst day that they've had, or their family member's worst day. So I'm sure that helps. So.
Yeah, I'm sure. Well, I know we have students joining us from all over the state today, and there is a chat feature on their Zoom login. So if you're a student or any participant today and have questions about EMT paramedics, we encourage you to put those in the chat for Jaron. And Jaron is here to tell us about some of those questions we're seeing live. Jaron?
Yeah, thanks, Cindy. Hello, Troy and Alex. The first question that we have for you both is, do a lot of things that happen on the job stick with you on in your personal lives? Is it something you think about daily? And really, maybe how do you cope with some of that you do see?
Yeah, I think that's a great question. We see some of the best moments of people's lives, and we're there to share some of the worst. And I think National EMS advocate Tom Dick really had a good quote about that. He said, "You're going to be there when a lot of people are born. You're going to be there when a lot of people die. In almost every culture, such moments are regarded as sacred and private, and made special only by a divine presence. And no one on earth would be welcome to those, but we are personally invited." And what an honor that is to be able to share that with our patients. So a lot of those moments do stick with us. Here locally, we have a peer support group that we can speak with other EMTs, other paramedics, other people in emergency services to share kind of how we're feeling, if something's bothering us. But we also want to celebrate the wins too. Like Alex mentioned, we had that clinical save. So we want to be able to not only share when we are having something that's kind of sticking with us, that's bothering us, get that out in a healthy way. But we also want to celebrate when we've had a success in the patient care as well.
Yeah, that's a great point. Thanks for sharing that. And so the next one, which I'm sure there's lots of folks maybe wondering this, what exactly is the difference between an EMT versus a paramedic?
So an EMT, so there's three different levels in Kansas. Technically, there's four different levels. You can start out as an EMR, so a first responder, and so that is the it's the first step. You don't have to do it to do your EMT, but it's definitely the first step to be a first responder. And then you have your EMT basic. So that's about a semester worth of work, and then you can work on the ambulance with your EMT basic, and that's just your broad kind of rundown of all the medical terminology and how to work on a truck, basically, and to do patient care. And then you have your advanced EMT, and that is a little bit more in depth. You can do IVs, you get to do some medications, a little bit more of the, uh, how to diagnose things. And then you have your paramedic, and the paramedic's the highest level. It's basically whatever you feel comfortable with and whatever you can legally do. It's an associate's degree, so it's a little bit more training, a little bit more in depth. So
Yeah, no, thank you. I think that's really helpful. The next one, how does working for a hospital differ from what working for the city or a private company? Do you get less emergent hazards compared to EMTs working for maybe other organizations because you're not as directly related to 911 dispatchers? So maybe shed some light on that.
Yeah, so in Anderson County, we are the primary 911 response agency. So we are working pre-hospital all the time. That's our primary duties. We have about an 80% call volume of 911 response and about a 20% response of transfer. So taking people from one hospital to the next. But there are so many opportunities in EMS. There's hospital-based services, as you mentioned, city, county, private-based services. You can work in healthcare centers, amusement parks. So Worlds of Fun, different places like that have EMS providers that are on site to provide care. But the most unique opportunity that we have being a hospital-based ambulance service is being able to work both in the emergency room and other parts of the hospital, such as surgery, to maintain some of the skills that we aren't necessarily doing a lot of out in the field, but we are able to maintain that competency and maintain our skill set by practicing in the ER as well as other parts of the hospital.
Yeah, that's very helpful. Um, the next one, is there a good work-life balance doing this job? Do you have times for things like hobbies or just getting days off, or are you on 24/7?
well, so with our schedule, we usually work 24/48. So you're on for 24 hours and then you're off for 48. So it's basically like every day is a Friday because you have the next 2 days off. So there are definitely challenges with working 24 hours, but you only technically work 2 days a week most of the time. So that's nice that you get, the rest of the time off. Instead of having a 5 day work week, you have a 2 day work week and then 5 days off. So definitely it's challenging in some ways because of holidays and weekends, but it's very nice being able to have that time during the week and you actually have more time with your family, I would say.
Good. What is the main call you go on in terms of emergencies? And also, someone asked, how long does it take usually to get someone to the hospital?
That's a good question. So the primary call within the state of Kansas pretty regularly is ground level falls. So we see a lot of elderly people falling, or whether it be weather related. So medical responses outweigh traumas. So we can respond to a lot more medicals than we do trauma calls, and oftentimes they're not as serious. But we are responding to someone's emergency. It's not our emergency, it's theirs. And if they see it as an emergency, that's how we need to treat it. Um, as far as transport and how long it takes, we really aim at some key targeted times. So we call it a platinum hour. So if we have a trauma patient, we want to get them to a trauma center within an hour. We have sorry, that's the golden hour. We have the platinum 10 minutes. So if we're on scene longer than 10 minutes with a trauma patient, we want to get them out. We target our on scene time for medicals at about 20 minutes. And then our transport times vary. So we're a very rural county. So sometimes it can take us 20, 30 minutes to get to the patient, 20, 30 minutes back to a hospital. Whereas if you're in an area such as Shawnee County, Topeka, Johnson County, Sedgwick, Wichita, you're going to be much closer to a hospital, and those transport times will be much shorter than what we experience in rural areas.
Yeah, that's a great comparison. And I know we have a great blend of students and folks watching from across the state. So that's helpful to share that. So next, before I think we want to see some of the equipment you have around you, but maybe one other question before we maybe look around the ambulance a little bit. What are some opportunities for advancement as an EMT or paramedic? And then also, if you have Kansas certification, does that transfer to other states?
I'll let Alex touch base on the transition because he actually recently transitioned from EMT to AMT, and then I'll discuss a little bit as far as the reciprocity and what it takes to move state to state.
Yeah, so as an EMT basic is kind of the start for everyone. To be an advanced EMT or paramedic, you have to start out as a EMT basic. But then the advanced EMT is like another semester of schooling. And then the paramedic, like I said, is about an associate. So it's about 2 years. And then, within the job, there's definitely room to grow. Some places have, captains or assistant chiefs, chiefs. If you're part of a fire department, you have their, advancements also. You could be an engineer or captain or, fire chief. So there's definitely room to grow in about every job that you have. Even if you're a paramedic, the highest, medically trained, there's definitely room to grow to management or something like that.
And the great thing about here in Kansas is there's a lot of scholarship opportunities to help with that advancement. So the National Association of EMTs has a $1,000 scholarship to get your first responder or your EMT, that initial education. The Kansas EMS Association has a $1,500 scholarship. The Kansas Board of EMS offers tuition assistance for those people who are already working for an ambulance service and want to progress. And that's how we actually paid for Alex's advanced EMT program. And then various services. So here at St. Luke's, we have tuition assistance, and a lot of services will help you once you get your foot in the door and have that strong role as an EMT to kind of help advance throughout. When we're looking at reciprocity, to work in a state, you have to have your Kansas license through the Kansas Board of EMS, but you can also get your National Registry EMT. So the National Registry of EMTs offers a lot of compact states or reciprocity, being able to go from one state to the next. So I really encourage anyone who's looking at obtaining their EMS certification, always maintain your NREMT, because you really don't know where life's going to take you. And having that NREMT recognition will help you move from state to state.
Well, thank you for answering so many questions. In our last couple of minutes that we have, I see some equipment around you. Would you mind sharing a little bit of what you've got going on and maybe some of what students might be able to see if they were in your shoes?
Yeah, absolutely. So Cindy mentioned we're in the back of one of our ambulances here. So we wanted to share that experience and let you see kind of where our office is. So we don't have that typical office of sitting at a desk or working in a controlled environment. We have this big box that's driving down the road, at 50, 60 miles an hour, and we're trying to do patient care back here. So we have some different equipment that we can share with you that we use on a pretty typical basis. So probably our first piece of equipment is our cardiac monitor. And not only does this cardiac monitor show us a heart rhythm on the screen, but we can obtain vitals such as blood pressure, pulse oximetry to see the oxygenation in the blood, a pulse rate, end tidal when somebody's breathing. But the other neat piece of equipment on this is a equipment that transmits. So we can take a look at someone's heart and we can transmit it to the hospital so the doctors and the care team at the hospital can actually see that and be prepared when we transport that patient in. So it gives a really great continuity of care for them to be prepared of what kind of patient we're bringing in.
Another thing that we have is we call it the red bag. That goes in to the house with us on every call. Or sometimes it's not a house, it's out a wreck or something like that. But usually we have this and that monitor with us everywhere we go, because this has airway things. It has bandages for wound care. It has medications, IV stuff. So basically everything that's for the most part in the ambulance, there's one of those in here. So we have like a little mobile ambulance with us right here until we can get to the back of the ambulance, because of course that's where we want to be. That's where all of our cool toys are, and we have lighting and all that stuff, climate controlled. So, but yeah, that's some of this.
And one other piece of equipment, as you can imagine, when there's typically only, see, our lighting went out. So we just did that as as a experiment to show you how easily it is to work in the dark in the back of an ambulance. So, but one other thing is there's typically only two people on the ambulance. So if Alex and I are responding to an ambulance by ourselves, it's hard for us to do chest compressions if somebody's in cardiac arrest, get the medication on board, and manage their airway. So we have this device called a Lucas device. And so we're able to put this on a patient and it will actually do CPR for us. It's more efficient than us doing it. It's, a machine doesn't get tired like a human does. It stays consistent with the CPR that's being delivered, and it frees us up. Additionally, it's safer. As you can imagine, riding in the back of an ambulance down a highway is probably not the most comfortable or safest to be standing up and working on a patient. We need to be seated. You see the seat belts in the back. So this allows us safe transport of our patients as well.